The death of O.J. Simpson will hopefully shed more light, though, on the racial disparities that exist for black men when it comes to prostate cancer diagnosis. According to the American Cancer Society, black men are 1.5 times more likely to get prostate cancer than Caucasian men. And if they develop it, they're twice as likely to die from it than Caucasian men. Joining us this afternoon to talk more about this is Dr. Pat Fulgham, a board-certified urologist, the surgical director of oncology at Texas Health Presbyterian Hospital, Dallas, and the chairman of the hospital's cancer committee. Dr. Fulgham, thanks so much for being here with us on this important topic that I think might catch a lot of people by surprise.
Thank you very much for having me on. I think it's an opportunity to talk about something that we've worried about for a long time, and that's why black men tend to be more likely to get prostate cancer and to do worse when they do get it.
Okay, so in addition to the disparity rates of diagnosis and death, we understand that black men are getting prostate cancer earlier, 3 to 9 years younger than Caucasian men. Do we know the reasons for that?
We don't know for sure, but there are some theories that because prostate cancer is a hormonally sensitive disease, a lot like breast cancer in women, one of the theories is that because black men reach puberty at younger ages than white men, it may be that they've got a longer lead time to be exposed to the adverse effects of testosterone. It's also possible their receptors for testosterone are increased because of increased in utero exposure to testosterone. So there's several theories, but no one's really agreed for sure why men tend to get it. Why black men tend to get it more often.
Okay, so we have this disparity in diagnosis as well, and I want to touch on this. There are some new guidelines now for screening black men for prostate cancer. Can we get into those and how important those screenings are?
Well, they're extremely important because when we find prostate cancer early, we do a tremendous job of curing it or keeping it at bay for the rest of the patient's lifetime. When we find it late, the outcomes are not nearly as good. So early diagnosis is critical. We know that black men get it earlier, so especially if they have a positive family history, black men should start getting their first screening examination starting at age 40. For everyone else, it should start at age 45 and continue annually thereafter.
I want to ask you one last question here. You know, we talk about the disparity in death rates here. You mentioned that when this cancer is caught early, it's so much more treatable. You know, for black men who are saying, man, you know, I hate to see these numbers about the death disparity there. It works the same, doesn't it? If I'm a black man and I'm screened for this and it's caught early, I've got good chances, don't I?
Absolutely. Stage for stage, black men do as well as anyone else when diagnosed. It's that they tend to be diagnosed late. And it's in part because our current screening numbers weren't created with a large black population taken into account. So a PSA number, which is the screening test we use, which would be considered safe or normal for a Caucasian man, may indicate a higher risk of disease in black men. And so that's one of the reasons we're trying to start making the diagnosis earlier by reconsidering what should be the threshold values for that screening test.
So get those screenings extra early. Some great information here. Really hope that this might help save some lives. Dr. Fulgham, thanks so much for sharing this with us today.
Thank you very much.